welcome to Appleton Engaged. I'm your host, Timber Smith, DEI coordinator for the City of Appleton.
And I'm Andy Anam, the communications manager for the City of Appleton.
And Appleton Engaged is a podcast that explores the many people, organizations, and resources that make our community a great place to live, work, and play. So whether you're a longtime resident or just getting to know Appleton, join us as we learn more about our community together.
We are here to bring you the incredible stories of our community, and today we have a representation from an amazing organization, the mission statement that making a difference in the lives of people, creating a healthy community. Can you introduce us to that special guest?
Oh, yes, most definitely. And you are right. And we do have a fantastic guest this week. This week's guest is Trish.sarvela, who is the Chief Development Officer for Partnership Community Health Center. Hey, Trish, how are you doing?
I am doing great. Thank you for having me.
Thank you for being here and giving us time and getting ready to share about your amazing resource.
Absolutely.
But before we jump into that, can you please tell us about yourself and your association with Appleton in the Fox Cities region?
Well, it's easy because we came here in the year 2000. So every year that it turns into, I can say I've been here for 24 years almost. So came out here with a job transfer with my husband and raised our 3 kids here. We are involved in sports and activities. And my last child will be graduating from the Appleton Area School District this year. So I will be officially done with that. But it's been a great community to move to. I've been blessed to be involved as a founding board member with the Appleton Public Montessori School, as well as the newly founded Multicultural Coalition, and continuing to do my work with Partnership.
Oh, wow. You're involved.
It's a great place to be involved. I really feel like Appleton is one of those communities that there's so many opportunities to make a difference. And whether it's in your personal life or your professional life, there's always something to get involved in.
You are right. We are a very resource-rich region, and hence why we have Appleton Engaged, because we want people to learn more about these amazing resources. That being said, can you please share and tell us about Partnership Community Health Center?
Absolutely. Partnership, when I'm asked to talk about it, is really a historical story. And some people might say, Partnership, I've never heard of that before. But if we turn back time to the early 90s, we began as a free clinic, and a free clinic in the basement of the Salvation Army, really taking care of people who were experiencing homelessness. And it was a model where the 2 hospital systems, philanthropists, and concerned community members came together and said, how can we help? One of the things we know about a free care model is it's really hard to sustain. So at that time, there were some federal dollars available, and our community came together, and certainly predates me, to request these dollars to bring in an opportunity to become a community health center. And what that meant is we joined the nation where there are over 5,000 community health centers doing work in the grassroots community and addressing the need. So we're not just a little standalone as we were over at the Goodwill Building or Fox Communities Clinic or La Clinica or however people referred to us. We were part of a movement of community change that addressed the health needs of the people in the community who need it the most.
I can't stress how, and it is, health is everything, right? If you don't have your health, you don't have anything. And the fact that we have this in our community is amazing. And to know that this started from serving our unhoused population, that's cool.
Absolutely. And what I love about the story, the genesis of this work, is it was the community identifying need and trying to come up with a solution. So move the clock forward, and comes 2013 when our nation was on the move of the Affordable Care Act and the rollout of all of this change with health insurance that would now be available to everyone, not just the lucky few who had employer coverage or others. And we knew as an organization that we needed to take this as a huge opportunity, that we needed to change our name, because we were Fox Cities, and that's really a geographic location, but we serve everyone. Everyone is welcome at Partnership. We don't ask you where you come from. We don't ask you if you have a social security number. We don't ask you anything other than what type of care do you need, and then we enroll you in. So we knew that moment was so important to not just be a geographic location, but change our name to partnership because we knew we needed to partner with our patients, with our teams, with our community partners, because together we can really make that difference in health.
What are some of the services that are actually offered through partnership?
Well, when we started, we had just volunteers doing medical care. Now we have a staff of over 130 fully employed members, and we provide medical, dental, behavioral health care, and wraparound services.
Wow.
It's huge. And when I think about it, we have a site in Oshkosh, Wapaka, and then 2 sites in Appleton, one for dental and one for medical and integrated behavioral health, and then our team that focuses on enrollment into health insurance. So we've moved from that, small moment of years gone by to really being a site of care, if you can believe this, Timber, for 16,000 plus people in our community.
You said 16,000?
I said 16,000.
That's amazing. So, but in a whole nother sense, that makes me wonder, like, we've got 16,000 people out here who need these services because they don't have other access to healthcare. Is that what I'm getting out of that?
You're hearing that there are 16,000 people who choose to get their care in the community health center model.
Okay.
We proudly accept Badger Care, which is our Medicaid state insurance product. We accept private insurances, and that's a huge piece because that's a source of funding to come into the organization. We also help people with our sliding fee scale, and we have 3 dental sites, which really, for people who are on state insurance, there aren't a lot of other options for them. So knowing that we can really help with the connection between oral health and physical health is huge. So 16,000, and I can say proudly, I'm a patient at Partnership. I could not support a service that I did not utilize myself. So it's great. And we're always accepting new medical and behavioral health patients and dental patients, and out in Wapaka and Oshkosh, we're ready to take care of people's smile.
Okay.
So I have questions, and you have already expanded on that. Like, let's say if a person doesn't have any kind of insurance and maybe new to the country or any, those kind of population. So, what kind of facilities does the clinic offer? And also just to be more precise about what kind of, offerings do you have for children and, anybody facing homelessness? Because I believe they don't have any access to any kind of insurance, whatsoever.
Well, there's a couple of different answers to your question. For people who are newcomers here, who are coming in through certain programs, we do everything we can to work with the organizations to make sure we enroll them into health insurance if they're eligible. Mm-hmm. For people who are ineligible for health insurance, we have a sliding fee scale, and that's from $0, a nominal fee of $20, up to $80, based on income and household size. So people who aren't eligible or maybe can't get it through work or other things, we're able to put them on the sliding fee scale. Though I will tell you, we do everything we can to find a plan that can work for most people. We also find that there are families who have mixed documentation status, mm-hmm. and they might have, mom and dad might be ineligible for health insurance, but they might be a little worried, but their kids are U.S. citizens and they might not have enrolled them into Badger Care or into something else. So we help with that. And we help with people who speak languages all over the world. We utilize a language line. And if you can believe this, last year we saw people who spoke 67 different languages at Partnership. So really to make that connection so people know that they have an opportunity, because if the 3 of us said about what would our life be like if we didn't have access to care, or we were struggling with a chronic disease, or had a child who was ill that needed an inhaler, or a mom who might need, reproductive health care or other types of things, and not being able to access those services, how would that impact our life? And we all know someone who's in a situation like that. For many years, I think people thought that Partnership was for those people, a group of people. We're for everyone, because everyone knows someone who struggles. Everyone knows someone who's out of care, or who might need insurance, or might need affordable medication. And that's why and I love that you read our mission, because it's really about creating that community together and bringing people so we connect. And it's about health equity. It's about change in the community. So when we talk about helping a young mom get health insurance so her kids can be healthier. They're better students. Mom's back to work. The family is stabilized. There's so many pieces there. So great stuff. And you did ask about people who struggle with housing. And many of them, because our state has done a great thing, has covered children up to 300% of poverty. And some people are like, Trish, tell me what that means in math language. If you're a family of 5, you could make close to $100,000 and your children are still eligible for Badger Care for the state insurance. Mm-hmm. And whenever I say that and we look at the federal poverty, people go, really? I had no idea. So people who are feeling that they're struggling making those medical bills, payments, medical debt is the number one reason for bankruptcy.
Right.
Mm-hmm.
It's not the fancy car or the fancy house in the Bahamas. It's really trying to get by and paying those medical bills. So we love to help people. It's our mission to help people connect with that coverage so they can get the care they need and deserve.
And I noticed you earlier you had mentioned something about medication. That's in there also?
Absolutely. If you are a partnership patient, we have a special medication program through Walgreens currently that you're able to purchase medication at cost if you don't have a pharmacy plan. So if grandma has diabetes and she doesn't have pharmacy coverage, she could get that insulin for $15.
Wow.
By virtue of being a patient at partnership. So not only do we get great care and give great care, there's some really wonderful programs that can help people stay healthy.
So is community partnership programs are only for people with a certain income level, or is it open to people outside the Fox Cities region? Like, how does this thing work?
We have seen, because we're a community health center and we have a budget of around $15 million, which is something else moving from a free clinic to that level, because we accept private insurances and we accept Medicaid and we're able to do our sliding fee scale, we're open to anyone. We've seen a growth in patients coming in from Southern Brown County, people from Northern Fond du Lac. Our original service area was the Tri-County. Mm-hmm. But really the need in the community continues to grow, though I looked at our new patient stats right before I came, and the biggest feeder of new patients coming into partnership are people from the city of Appleton.
Wow.
People from the city of Appleton. And when I look at the demographics of those people, 75% of them are from communities of color. And that, to me, is really connecting us back to our mission. We are here for everybody, but knowing the health disparities that people of color face, the challenges that they have, for us to be a safe place, an equitable space, and one where they just don't come one and done, but they engage in care. They connect with their providers and their care team. They get the dental care that they need. They get the behavioral health care if that's something that they're looking for. And they get fantastic, high-quality services. So for me, that's a real point of pride that we're able to serve everyone, but knowing that there are communities who are much more vulnerable and much more fragile and need additional support, whether it's language, transportation, insurance enrollment, all of the things to make that 20-minute visit with your provider happen so they can then become a healthier member of our community. It's huge.
What I would actually say is, what it says to me is that you've earned trust.
Mm-hmm.
Because if people from those marginalized communities are showing up, it's because there's been trust that has been built, and that's earned. That's not just given.
Absolutely. And trust is not built alone. True to our name, it being partnership, Trish is not out there just drumming up the business. I often say to my team, we don't scoop people up with nets and bring them in and deposit them. We really engage with the people doing that grassroots work because they're the messengers of the message. And us coming together with the Multicultural Coalition, with the culturally based organizations here who are phenomenal. This is where that trust work has been built. And it's really happened, I think, as a result, if we were to talk about something about COVID, really getting communities together with partnership and then the groups that were really outside of all of the information, this is where we were able to really make that difference. And certainly COVID was powerful and destructive, but what we were able to bring together from a diverse community perspective in our community here was connecting with these people to make sure that they were getting equitable care.
That is a power of partnership, I will say. I mean, and is there any kind of wait for the providers? Normally we see that in many health systems, like, patients have to wait for many months to get even first appointment. I faced that, firsthand in Reno when I was like, it took me 6 months to get connected to one provider. So do you see those kind of challenges in here?
We do with our dental program, and that has been always a challenge just because the need overwhelms the capacity. However, if people are looking for primary care, we have capacity. We have 3 providers who are native Spanish speakers. We have some wonderful new nurse practitioners who have recently come on. Our medical director trained in a community health center, and she works closely with residents from the Mosaic residency program. So if someone were to say, wow, I really need to get in, I need a physical, or I'm sick, or I'm worried about something, could I get an appointment? Absolutely. You can call in and we do have access, maybe 1 or 3 days, depending how far out. And we are always accepting new patients. And check out our website at partnershipchc.org. All the info is there. You can see the pictures of the providers, their bios. Everyone is board certified. Everyone is trained. Many of them came out of the UW Wisconsin system, and they are committed not just to providing care and getting you your script and sending you on your way, but they're committed to the mission as well. So you are going to get great, compassionate care.
Wow.
What services do you see people utilizing the most of at this time?
From a patient standpoint, because we are in a situation where we're calling the unwinding of Medicaid, where people need to renew their Badger care, we are seeing so many families going through that renewal process. And we have 11 people who focus on making sure people don't lose their coverage. And if they're over income with Badger care, getting them onto the marketplace, the previously referred to as Obamacare, but making sure that people are getting that coverage and really staying connected. And that's just across the board. We do that not only for our patients, but for our community. But one of the things that we see people really challenged with is transportation, food insecurity, languages. We have seen our language line costs go up exponentially because as we continue to serve more and more people from around the world, we want to make sure that they're getting the care in their language. So not only from a patient safety standpoint, but from a culturally competent standpoint. And I couldn't imagine zipping off to another country there I don't speak the language and talking about my intimate and important healthcare needs and feeling like I was heard as a patient.
So why don't you share a narrative that will help listeners understand the impact? Any story which always resonates your mind when you talk about the Community Partnership Clinic?
Well, I often feel very moved when I talk about these, and many of our team members have Kleenex on their desk because healthcare is powerful. Mm-hmm. And when you talk to people about changing their health, it becomes something that's not just, oh yeah, I just went to the doctor and it's fixed, but it's about how you can be a better person, a better family member. And there were a couple stories, so if I could tell a few. One of them is early on when we were starting to enroll people into health insurance, a gentleman came and he was very upset. And he says, I just need to get on this health insurance now. I've been uninsured. I make a lot of money, but I have a business and I could never afford it. And I found out I have brain cancer. And I want to make sure I make it to my daughter's wedding. And because I have not been able to get the insurance, I haven't been able to get to the care. I don't want to die. And when people think about health insurance, many people think, oh, it's a process. Let's just enroll you in and get you your card and go on your way. For this man, that moment when he was able to connect with coverage that potentially could save his life, who knows where he was with his health, but he saw that connection to looking for help, finding a trusted place in the community because he wanted to live for his family. And when we talk about that power of getting people connected to coverage, it's not just picking up that penicillin because you have a sore throat, but it's about changing people's lives. So I always think about him because he came in and he, in his little suit, bustling in, but he had a very powerful message that there was such a need. So when we think about the role that health insurance plays in our life, it's huge. But there's so many. And one gentleman came in and he lived in Appleton, actually, and had really a lot of challenges with his oral health and needed to have his teeth removed. And it was an arduous process. And we enrolled him into insurance so his dentures would be covered and went through the whole process. The day he came in to pick up his dentures at Partnership, he walked in and he had a huge bouquet of flowers, and he was wearing a suit and a tie. And he said to the staff, I'm giving you flowers because this day is second to the day I was married, because these teeth have given me a new lease on life. And when you think about what that means, your smile, your ability, your self-esteem, I still see him with these flowers and just that power that he saw. And when you take care of your teeth, you're taking care of your heart, you're taking care of your whole body, you're taking care of everything. So those, just are kind of quick ones. But when I think about how this changes families who didn't think that they would be able to get their kids covered, something as basic as, wow, I could never afford an inhaler and my child plays soccer. And now I'm insured, and now I saw your pediatrician. She's wonderful. We got the inhaler. My kid's back to school. So little things turn into big things.
That absolutely do. And I can totally see the impact it has on the community and on the people who avail the services.
That gave me goosebumps.
Yes.
Like literally the story of the gentleman in the smile. Like I felt that.
And I think about what it must have taken for him to come into care, because so many times, many of our patients, whether they're medical or dental or even people coming into insurance, they might feel a little bit of shame. They might feel like someone's going to be like, so where have you been? How come you didn't take care of this before? I think we all probably feel that way if we're like outside of our physical, or we don't want to hop on the scale and like, yeah, where do those 20 pounds come from? Your diabetes? No, we really try to welcome people where they are at and where they want to begin. I may feel like, wow, you really need to go do this first, but the patient is always first. And they may say, I want to start with this first, and build that trust relationship around the care. 16,000 people to build that trust relationship around. So we're partners in moving forward. They're not recipients of what we tell them to do, but we're fused together as partners to really make that difference. And just a little commercial break to say we were just awarded a top national quality award for being in the top quartile of the nation in providing high quality care to our patients. And that's huge in this community.
We have that in our region?
We have it right down the street.
Oh,
That is so amazing.
Now that is truly a community point of pride.
Absolutely, because many times people think, oh, you're a community health center, or you're going to be sitting on a folding chair with a light bulb above you with a physician who wasn't trained. To have that level of quality that's documented each year and recognized is amazing, because, again, it speaks to, you may be experiencing many challenges in your life. You might be low income. You may not speak your we may not speak your language, but guess what? You're going to get fabulous care, and we're going to be part of your journey in healthcare to keep you and your family healthy.
There's just something so fundamentally important about that, because once again, your health is like, without your health, you don't have anything. And so to have those services here in this community, wow.
Yeah.
Are there any upcoming initiatives, events, or engagement opportunities coming up?
We are constantly doing events in conjunction with the Multicultural Coalition and all sorts of community groups. So I would say to the listeners, if you have an event that you think, wow, partnership would be great to be at, invite us. We would rather go to you than have you come to us, because when we're embedded in the community, we're not trying to wrangle up people to come. You already have your community there, and we can offer our resources to people.
I'm not going to lie, Trish, I do see you everywhere.
Well, that might be true. That might be true.
You're in the places to be, no doubt. You are truly engaged with the community.
Well, I love it. There's no other way to live in my mind. Community is everything.
So what are the other ways community can help and support this beautiful initiative?
Learn more about us. I think if people are interested, reach out. Let us know how we can talk to you, because as we said at the beginning, everyone knows someone who's in need. And I always wonder, who aren't we reaching? Who's not there? Who might have benefited from our services? So at a very basic level, let us know how we can help and make those connections. We don't do a big golf outing. We're not fundraisers in that sense, but we're always looking for community support, because quite honestly, with the growth in multicultural populations, we have incurred a huge cost with our language line that's non-reimbursable. So last year, we had an $80,000 cost that we incurred. This year, due to the growth in multilingual populations, we closed the books at $300,000. And
Oh,
when I think about that, I stand behind health equity and the role of care where we can make sure people are understood. But from a bottom line standpoint, that's not sustainable. So if there are opportunities that people say, I'd really like to help, I'd really like to find ways to support. We're not looking for bake sales, but we're certainly looking for people to come together because our services are community services. Everyone we care for lives and works in this community, and we can't alone sustain that. So as we look to our local funders and other groups just to get people connected and feel the power of the work and want to be part of it, and whether that's financial support, whether that's spreading the word or inviting us out or inviting me to come chat with your business and really get them excited about the work we do, along with the work we do with the United Way and other community partners, we're always here for you.
who can people contact if they would like to learn more? Or maybe to ask you to show up at their workplace or at an event?
Probably the easiest way to do this is we've recently updated our website, so we have a contact form of submission that defaults into my email. So you will always get me if you fill that out. Regardless of what you need, I will know because it will come to me. So you can go to www.partnershipchc.org. If it's easier to remember 211 at the United Way, they always zip people over to us. Or you can call our main number and just say, I'd like to speak with Trish, and they will get you connected.
So now is the time for the shout out. So do you have a team of people you want to send shout out to?
I have a couple decades worth of shout outs to the visionaries in the 90s in our community who said, we need to make a difference because we see need. They were the groundbreakers. They were the ones who left the trail open for us to move forward on. And I often run into people who say, oh, I remember that, or I volunteered there, or you guys are still doing that. To that moment where change was able to happen, I thank them because without that initial work, we would not be where we are. And a shout out to the entire community who partners with us because true to our name, we can't do it alone. And we could live in isolation and wonder why people don't show up and why there's nothing happening. This is transformative work. So I couldn't put out the whole list out there, but other than saying that the entire team at Partnership and all of our community partners from basically sea to shining sea, thank you. Thank you for trusting us, believing in us, and being part of making a difference in the lives of people and ultimately creating that healthy community.
Trish, is there anything that we didn't ask that you would like to share at this time?
Timber, we could always sit back for another hour and chat.
Fair enough.
I just think keeping an open mind as we move into this next year about the possibilities of how we can improve the health, the wealth, the well-being of our community. You said it the best, everything is connected. And when we think about health, we have to think about everything. So knowing that we're here as your partner and we don't have all the solutions, we're open to innovation, we're open to new ideas. What we may do today may be very different than what we do in a year because things have changed. So keep us relevant, keep us connected, and invite us in to be your partner in your healthcare journey.
Trish, thank you.
Thank you.
At this time, we're going to start wrapping up this episode. So I just want to take a moment and say, Appleton Engaged listeners, thank you for spending time with us. Thank you for giving us your minds and your ears. Thank you for wanting to learn about another amazing resource in our community serving us apparently at the top levels, which is just fantastic. As you know, we are a work in progress. If you have anything to help make us a better podcast, would like to share anything, or if you would like to be a guest, or if you would like to recommend a guest, please don't hesitate to reach out to us here at Appleton Engaged. And the way you do that is through our email, and our email is diversity@appleton.org. Once again, that is diversity@appleton.org. And we have one more ask, and that ask is this: please help us reach more people. And how do you do that? That's by improving the analytics, and you improve analytics by hit the subscribe button. You're listening to us right now. Just take a moment, hit the subscribe button, or leave us a review. Good, bad, or indifferent, leave us a review. And what that does is it improves our analytics, and better analytics puts us in front of more eyes and in more ears. So thank you.
So this was Trish from Partnership Community Health Center, which continues to make difference in the community. And we would love to see it expanding, and more expanding. So please support the organization. And with this, we say goodbye to you with a promise to come back again with another wonderful episode. Until next time, stay thoughtful, stay curious, and stay engaged.